Anterior cruciate ligament, ACL, tear repair is a surgical procedure designed to treat a damaged or torn ACL in the knee joint. The ACL is one of the major ligaments responsible for stabilizing the knee and preventing excessive forward movement of the tibia, shinbone, relative to the femur, thighbone. ACL tears are common in athletes, especially those involved in sports that require sudden stops, changes in direction, or jumping. The surgical repair of an ACL tear is typically recommended for individuals who wish to resume high-demand physical activities, such as sports or physically demanding jobs. The procedure is performed by an experienced orthopedic surgeon and involves the following steps. Pre-operative assessment. Before the surgery, the patient will undergo a thorough evaluation to assess the extent of the ACL injury and identify any associated damage to other knee structures. Anesthesia. The surgery is performed under general anesthesia, which means the patient is unconscious and pain-free during the procedure, or under spinal anesthesia, which means the patient is awake and pain-free. Arthroscopic approach. In most cases, the surgeon will use an arthroscopic technique, which involves making small incisions around the knee joint. Through these incisions, a tiny camera, arthroscope, and surgical instruments are inserted to visualize and repair the damaged ACL reconstruction. In the majority of cases, ACL repair involves ACL reconstruction. The torn ACL is replaced with a graft, which can be harvested from the patient's own patella tendon, hamstring tendons, or from a donor, allograft. Graft fixation. The new graft is secured in place using screws, staples, or other fixation devices to anchor it in the original position of the torn ACL rehabilitation.
So this is the PCA. It is intact. The ACL footprint is broken. It should be completed. Now I'm removing this broken cut. The complete ACL.
Dr. Nihal Fernando, an experienced orthopedic surgeon in Sri Lanka, is shown here performing arthroscopic ACL repair with an excellent success rate. After the surgery, the patient will need to undergo a carefully tailored rehabilitation program to promote healing, restore knee strength, and regain full range of motion. Physical therapy is an essential part of the recovery process and may take several months. Recovery and return to activity. The recovery time varies from patient to patient, but it often takes several months before the patient can return to full physical activity. It's crucial to follow the surgeon's and physical therapist's instructions to avoid complications and ensure a successful recovery. Overall, ACL tear repair is a complex procedure that requires skilled surgical techniques and a dedicated rehabilitation process. The goal is to provide stability to the knee joint and enable patients to return to their desired level of physical activity with reduced risk of future knee problems. As with any surgical procedure, there are risks involved, and it is essential for patients to have a thorough discussion with their orthopedic surgeon to understand the potential benefits and drawbacks of ACL repair.